of malnutrition. So we support members countries to transform agriculture system into an inclusive, resilient, efficient, and sustainable system, leading to better production, better nutrition, better environment, and better life, leaving no one behind. In order to answer your first question about One Health, the official definition of One Health was given by the One Health high-level expert panels in 2021. It is an integrated and unifying approach that aims to sustainably balance and optimize the health of human, animal, and ecosystem as a whole. So basically, it means that we are taking action, taking into consideration of the linkages and interdependence of health between human, animals, be it wildlife, livestock, and also including plant and also ecosystem as well. To give you an example of One Health application, because it is an approach, we actually apply it to certain issues. Johan already mentioned too, infectious diseases and antimicrobial resistance. When we apply One Health to infectious disease, in general, there are two goals. One is to reduce the impact of the disease, and second one is to reduce the risk of future threat that may emerge in the future. Vietnam is actually, at the forefront of implementing One Health, because, as I said, action or decision that you take on one sector can significantly impact other sector, either in a positive or negative way. So, if you think about going back to 2003, 2004, avian influenza, highly pathogenic avian influenza outbreaks in Vietnam, at that time, there were more than 2,000 outbreaks altogether. And then Vietnam made a decision to use vaccine, right? And at that time, actually the goal for using vaccine though, is actually to reduce the amount of virus that is in the environment in Vietnam as a whole, right? If you have 2,000 outbreaks in animals, you have a lot more chance for exposure to human than if you have 20 outbreaks, right? So, and after 2006, when we start using avian influenza vaccine, of course, the number of outbreaks in human reduced significantly to 0 in 2014. And we haven't had any human case of H5N1 in Vietnam since 2014 until the one last year in Phu Thọ province. So this demonstrates the understanding though that the decision for the intervention in animal health sector can benefit public health sectors. I understand that France also start using vaccine, and the US is considering it, but for a very different reason though. But again, the decision that we made and the intervention in the animal health sector can benefit others. For the US, it would be for conservation as well. And in terms of reducing the risk of the future emergence, excuse me. So if you think about COVID-19, COVID-19 is of course not the first disease that's emerged in animals and transmitted to human. We know that 70% of infectious disease that human has are transmitted from animals. Now, another issue that we worry though, that the pathogen, or well, not the pathogen, the agent that is already common in animals can pick up virulence factor and becomes virulence to human. And there are many drivers though that can lead to this emergence. For example, the close encounter between wildlife and livestock. As if you remember Nipah virus in the past, the outbreaks in Malaysia began because of the close proximity between pig farm and the bat cave, right? That allowed transmission of Nipah virus to pigs and eventually to human. So if we can reduce this exposure, or reduce the interface between wildlife, livestock, and human, then we may be able to reduce transmission in the future. For antimicrobial resistance, antimicrobial resistance is an situation where infectious agent, either bacteria, virus, parasite, or whatever, that no longer responds to medicine. which make infection difficult to treat or an increased spread, because there are more bacteria or more agents in the environment. Therefore, One Health can be used. One of the main drivers of resistance, though, is the excessive use. Again, either in human or in animals. And this resistance capacity, it will impact, both human, animal, and also plant as well. Can impact plant as well. And therefore, One Health approach can be considered, if we take concerted action or coordinated action in all three sectors to reduce the amount of use, then we can reduce future risk of antimicrobial resistance emerge and spread. I'll stop here for now. Thank you.
Thank you. Thank you for this explanation. And we see from the beginning that this is quite a complex and multi-approach question. So, Dr. Dean Toy, as you are also very involved in the human health sector, could you give us some example on how animal health, human health are also interrelated? Thank you.
Oh, thank you, Duan. My name is Đinh Đề Chu. I'm from International School, Vietnam National University, Hanoi. I am the director of the Center for Biomedicine and Community Health, also in the Faculty of Life Science. And regarding to the question, but actually look like Dr. Pawin talking about many types of the disease that can transfer from animal to the human in Vietnam. Vietnam look like another country in the Southeast Asian country. We have a lot of type disease like that, especially the infection disease. Look like when talking about the avian influenza, rabies, Streptococcus suis or some other thing, and they also can transfer from the animal to the human. But actually in Vietnam, we do not have so many the training program and also the research funding about that. So in my opinion, besides we do a lot about working with the farm policy maker. We also need to improve the knowledge. I mean that we need to educate the population in Vietnam about the One Health approach in animal production. And also we also need to, need more the training program. Look like the bachelor, master or PD program on One Health. I think in Hanoi now, maybe only Hanoi Medical University, they have one master program on the One Health. But the other university, don't have that kind of thing. In the future, international school, we also have one program, the master program about the biomedical engineering and technology, but we have one sub-major on the molecular biomedicine. And on that kind of thing, we also try to link to something look like some kind of the pathogen molecular characteristic of some pathogen look like bacteria and virus, and also connect to the One Health. And you know that actually the way we are eating in Vietnam also look like we're eating something maybe we cannot control the quality of the food, especially the food from the animal. And also we also eat some very fresh foods, right? And also we can control the quality of the food, and maybe they also have the pathogen contaminated. So that's why it also affects to the human health. And the other thing, in our center, we also doing some research about some kind of the chemical contaminated in the food as well. Look like the meat from pork, chicken or the other thing. Maybe we have also some toxin chemicals there as well. And they also can affect on the human health as well. Okay, that is some example. Yeah.
Okay, thank you, Dean Troy. So, as we have seen, there is three main topics on this One Health. One is transboundary disease, antimicrobial resistance, and as well foodborne disease, contamination from meat to human. Talking a bit about the current landscape and the context in Vietnam, I would like to ask Mr. Tong Xuan Chin from Ministry of Agriculture and Rural Development. What is today the situation in Vietnam in regards of One Health topics, and particularly the master plan for the One Health that is ongoing, started a few years ago and coming for the coming years. What have been successful so far and what still need to be done in regards of One Health approach in Vietnam?
Good morning. I'm Tong Xuan Trinh, the Deputy Director of the Department of Livestock Production under the Ministry of Agriculture and Rural Development of Vietnam. As you know, in Vietnam now, we also have a serious problem about the climate change, but also have serious problem about the emerging diseases for the animal. For example, avian influenza or African swine fever. So we have a serious problem for our animal population. So the most important for Vietnam now, we have to use the medicine and also the vaccine for control the diseases. But the way we apply the vaccine and also the medicine for the animal also cause the antimicrobial resistance in Vietnam. So we think that it is very important for the world to recognize how important for the whole system in our society to become the way to again is antimicrobial resistance, not only in Vietnam but in the world and in the region, in the Southeast Asia, for example. So in Vietnam now, we recognize very successful about the way the FAO and the OIE and also the WHO to have One Health approach. And by that way, Vietnam now also in combination between the Ministry of Agriculture and also the Ministry of Health also have very good project about the One Health by the support by FAO and also different international agencies in Vietnam. So you know that in the world, the WHO also predicts that by 2050, about 10 million people will be died by the antimicrobial resistance. So it is very important for every member of the WHO and also including Vietnam, we have to develop very good national action plan for against the antimicrobial resistance. By that way, the government of Vietnam already set up the national plan for against the antimicrobial resistance for the period from 2023 to 2030, and also have the action for further plan for against the antimicrobial resistance. And you know that in Vietnam also have a problem about the small producer. For example, in livestock, now we have about almost 2 million very small producer for pigs, and about more than 7 million with for chicken and poultry. So the production scale is very small. So it is very difficult for the management agency to control how they use antibiotic for killing the diseases in the animal, especially for pig and for chicken. And before I came here, I also studied very carefully one publication, just very new publication for the antimicrobial resistance. The reason for that one, that the way the small producer to use antibiotic is something we could say that is overuse. For example, when we want to 1 kg of the chicken to increase, they use about 35 ppm of antibiotic. And we need 1 kg of pigs to increase every day. And they need about 172 ppm of antibiotics to kill, and sometimes also used for growth in the animal. So now follow the law of livestock in Vietnam. We already put in the article 45 to control the way to use medicine, especially for the antibiotic to killing the diseases in the animal. So by that way, we stop using the antibiotic for killing the disease and also for growth promoter in the animal by 2025. So after that, no antibiotic apply for the animal as a growth promoter. So we think that it is very important now. The MAS, the Ministry of Agriculture, should follow the very strong and very important guidance from the World Organization of Animal Health and also from FAO and also WHO, and also in very good combination with the Ministry of Health to carry out the project with the One Health project in Vietnam. So by that way, we think that we have to control better the animal diseases in Vietnam and also sustainable and also suitable for Vietnam to follow the way to against the animal microbial, antimicrobial resistance in Vietnam. That's something I would like to inform to you for today. Yes, thank you.
All right, thank you very much. As one mission of this meeting today is also sharing experience with European companies and the situation in Vietnam. European Food Safety Association published that over the last 10 years, Europe was able to reduce by 50% usage of antibiotics in animal production. I would like to ask the private companies involved in Vietnam as well, what are for you how do you explain this achievement in Europe, and what would be the good recommendation for Vietnam situation, for animal farm situation? So you could introduce yourself, Evert, to start with, and comment a bit on this question. Thanks.
Okay, thank you. So my name is Evert Visser and I work for Shippers Group. We are a Dutch company and we established our office in Vietnam last year. Actually, our mission is to eliminate antimicrobial resistance. And we do this by developing know-how, services, and also improving hygiene on livestock farms. Because as was already mentioned, worldwide, actually livestock industry is the main consumer of antibiotics. And our company has developed easy-to-use solutions to reduce antibiotics and veterinary medicine consumption. And at the same time, by doing so, also the farms become more profitable. Animal health is increased. The benefits of the help of the farm workers is also better. So If we look at, for example, Vietnam, as Mr. Ching also mentioned, in Vietnam there is still a lot of use, for example, of antibiotics. There are some statistics that in Vietnam, for example, 75% of the antibiotics is used in livestock farming. And actually about 80% of that number is used preventatively. And it actually means that the animal is not sick yet, but farmers, they use it for different reasons. For example, they may say, oh, today the weather is changing, so let me add some antibiotics. Or, hey, we want to increase the growth of the animal, so we will use some antibiotics as growth promoter. And that's actually creating a lot of problems in the sector because, of course, it leads to antimicrobial resistance, but also covers up the underlying problems. It's just as humans. So, for example, here also we have fresh water to drink, and we take care of our water because we know that if we drink bad water, we will get sick. But if you come to many farms in Vietnam, you will notice that the water quality, for example, is quite poor. And that's why also for us, for example, we help farmers to improve that. And then we have different areas where we focus on water quality, cleaning, care of the animals. And by doing so, we see a lot of positive benefits. And for example, Johan mentioned that in Europe we could reduce antibiotic consumption by 50%. But we see that, for example, companies that use our methodology, they can even achieve reductions of up to 90%. And we have the same experience in Vietnam. So we look very much forward to also helping the government to achieve these targets.
Thank you, Oliver. Turning to Mr. Dr. Phat, technical manager, you could also share a bit of your experience in between Europe and Vietnam, please.
Thank you. Good morning, everyone. My name is Phat. I work for Omic Group, a French company, manager in Asia. And Omic is a French company, and we produce feed additive for livestock. And our target, our company target is improve animal health and reduce antibiotic and chemical in livestock. And luckily for me, during my time when I work for company, I also take 3 months to work in the pig farm in France, and also had time to visit farm with Dr. Vet and visit slaughterhouse and supermarket in France. And I also work a lot with the pig farm in Vietnam and pig farm and poultry farm in Vietnam, and also in Asia area. So I can see it's quite big difference between the European management and for Vietnam management related on farm. And I think some key point relate on One Health. For the farm, it could be good to apply for Vietnam based on experience from Europe. The first one I think is really important, that is biosecurity. And we have a lot of the effort from European that come to Vietnam and share to the biosecurity. But before ASF, we do not take note on this. But after ASF, I can say that is right now biosecurity in Vietnam, it really strong, and even more strong compare biosecurity level in Europe, because the farm cannot survive without biosecurity. So that is a good point. We should to say thank you for ASF because of this. And second point is also important, that is when the pig farm, they enhance biosecurity level, and they step to apply for poultry farm. So that is a good point. With the enhanced biosecurity, we know that is we have less the health issue. That means it's less antibiotic use, for example. The second point I think is important, that is farm management. And in Europe, they do quite well about this, and the people really professional relate on the farm management, and the knowledge also sharing. And in Vietnam, for the big farm, right now they also have quite good. We know this because the performance is quite well also. And the third point, I think we can apply that relate on the prevention, disease prevention and control. And as you know, that is Vietnam livestock, Vietnam market is quite big in Asia. For big number, we just only below China, with number 2 in Asia. So all of the current vaccine available in our market. So for the vaccine is good. And we also thinking that is the auto vaccine could be good for Vietnam because in Europe they use a lot of the auto vaccine because different area, so we have a different strain of the pathogen. So auto vaccine is could be good tool, especially for the bacteria disease. And we know that is in Vietnam we do not have a legitimacy for the auto vaccine. So I think in future we should to focus on this and some method to replace antibiotic. Until now we do a lot of communication for our community already. And the third point I think is also important, that is related on the food safety. You see that is for this year we have a lot of the health issue related on food safety. For example, salmonella infection in the school. So in Europe they have a quite good system to monitor this. For example, each farm they have a farm code, and when they sell pig to the slaughterhouse, they need to do the farm code tattoo. And that means the pork from the pig farm, all the people can know. And when the pig sent to the slaughterhouse, at the slaughterhouse they have the government vet. They will control the pork quality, and they will decide which pork is a good standard to move to the market for the human consumption, and which one is cannot. So the farmer just only can get the money from the standard pork. And I think that is a really important point and could be good. And the last point is related on environment pollution. In Europe, they can manage quite well. And I know that is in Vietnam. Vietnamese government also really strict right now related on the environment control. So some point I think is based on my experience. Thank you.
Thank you, Fat. And thanks for practical example on traceability, which is very important to through the value chain. Gaëtan from CEVAC, could you also share your idea on these topics?
Okay, yes, thank you. So I share the view of the other panelists, and especially, despite the challenge faced by with antimicrobial resistance in Vietnam, we can also see that in the last years, with the arrival of ASF, unfortunately, many farms have been improving on the biosecurity point. Those that didn't, they probably have been also wiped out. So I think there is been a lot of improvement in the recent years, but it's still a big challenge for the farmer. We know that we have a very high disease pressure in Vietnam in general. So when we look at the problem with antimicrobial resistance, where is the tendency to use too much antibiotics? So usually it's two kind of cases. Number one is for respiratory disease that will affect, for example, the growth of the pigs, such as some pathogen like Actinobacillus or Mycoplasma. And for this, in Europe, so we rely 100% on the use of vaccines that work very well. In Vietnam, these vaccines are available, although they work well, but we still see a trend in the industry to rely also on, I think from the past habit, on some antibiotics that can be topped on the feed, like amoxicillin and other. So I think this is an area where we can do better in the future. The other area where usually we see news of maybe too many antibiotics is for digestive pathogen. So usually, especially when the piglets are around weaning time, they get very sensitive to digestive issues. And for this, yes, one part of the solution is also from the usage of some kind of vaccines, but also nutrition is very important. I think we have a lot of good solutions in Vietnam. Many international companies are bringing a lot of know-how in terms of nutrition around weaning time. But we also see that some things could be changed. For example, in Vietnam, we see a trend for the farmers to look for diet and feed with a high protein content. For example, if you buy a piglet feed, the farmer will think that it's better to have a high protein piglet feed, like 19%. And the issue with having too much protein is that this protein is also available for the pathogen to develop, so it will cause more pathogen problem. And the only way to maybe to have the high protein piglet feed with is to put antibiotic together to control the development of this pathogen. So in Europe, we use, for example, much lower protein content in the young animal diet. So I think it's also one area where maybe we have a room to improve in the future. And maybe last, because I don't want to talk too much, but I also feel that in terms of traceability at the slaughterhouse, we have room to do better in Vietnam. So in the past, the food chain was very separated. Now we see the development of more integrated link, like the many companies, like some here, developed the feed farm food system. And I think that in the future it should lead to more traceability and more responsibility also, and more marketing towards safe meat and responsible use of antibiotics. Yes, just to share a few main points. Yeah.
Right. Thank you, Gaëtan. We hear again the importance of traceability implementation that will help to value any change and orientation in the industry. I would like to go for a question from the audience. I will start with one first question that I have when I hear the European experience, and I think to me it's a key question because to be successful on antibiotic reduction, we need to have the farmer convinced that they could go for antibiotic reduction. And one important question is, do we have to compromise the economical profitability in the farm to be compliant with the One Health guideline and reduce antibiotic reduction? If you could share your experience on the private company point of view, and then we could go for the attendance question.
Yeah, maybe just one example that I have in mind. I will make it very short. So last month, actually, I was in talk with one big company raising pigs. And they face the problem of Actinobacillus, and so they were looking at vaccine option or antibiotic options. So one belief, and something that people think, that antibiotic is actually cheaper, but is not always the case. So in that case, we made the calculation for them. If they go for antibiotic, it would cost, that example was 27,000 Vietnam dong per head, and the vaccine was costing only 17,000 Vietnam dong. So it's not always more expensive. After, generally, the usage of vaccine is a little bit more work, because you need to, first to apply the vaccine, you need to inject all the animal, right? And also, you need to have a good diagnostic capabilities to know what is the disease environment of your farm, and what time would be the best to apply the vaccine. So maybe you need to do some lab tests, some work. Is not as easy, maybe practically, as to put just antibiotic in the feed and finish. So, but from the economic perspective, it's not necessarily more expensive. Yeah.
I have a small point to add, because of course from my company we look mostly at a hygiene or a biosecurity perspective. And what we see is that if you improve hygiene and biosecurity, for example, feed conversion ratio will go up, and that also will of course already directly improve the profitability of the farm. But also improved hygiene, improved biosecurity will lead to quicker cleaning times, so that, for example, especially in poultry farms, you can have more rounds per year. It's also increasing profit for the farmer. And also, as I mentioned, labor conditions improve. It's nicer to work in the farm. So also in terms of labor turnover rates, we see that they get reduced when biosecurity and hygiene is improved. And that also, of course, improves the management of the farm, because one problem that many farms in Vietnam face is that employees, they maybe work there 1 year or 6 months and then they quit. So then when they have to be retrained again, or you have to hire new people, then you have a bit of a knowledge gap. And by improving the labor conditions in the farm through hygiene and biosecurity management, actually you also save money.
So if I may add, from our experience working with small and medium-sized farm in Vietnam, FAO has been working closely with Department of Livestock Production and National Agriculture Extension Center to improve the animal husbandry practices and biosecurity in small and medium size farms, starting from poultry farm in response to avian influenza, and now we're also working on pig farms in response to African swine fever as well. The short answer to your question, whether we have to compromise or not, is no. We actually don't have to, because we know that there are ways to do it with simple intervention that improve good husbandry and improve biosecurity practice that can lead to reduction of common disease in the farm already. So if there are less disease, there are less reason to use antibiotics.
All right. Thank you very much for this very clear answer. And I think it's very important to clarify this point with the user of antibiotics. Time for a question in the audience. I will bring several questions. Okay. I will bring the question. John, Michelle, and David.
Thank you for allowing me to ask my question. Sorry for those who were with us already in this room. So I said this morning, my name is Delafont. On my passport is written European culture, so I'm a European with a Mediterranean culture. So countries like Italy, south of France, Italy, it could be Greek or Turkish. 6 years I work in Saigon. I love Vietnam, so I plan to stay here. My question is, that's going to be, I'm 60 years old, so I have no time to lose. First time I came to Vietnam, many of you were little kids, and a few of you in the room were not even born. So my question is a bit provoking. Let me explain. 35 years I'm working, 20 years in 2 companies. One of them is bioMérieux, or bioMérieux in English, and another one is Becton Dickinson. Those 2 companies are the 2 worldwide leaders in microbiology, bacteriology, virology. I'm not a virologist. I am not a bacteriologist. I'm not even a doctor or a nurse. Nevertheless, I worked 20 years with these people, and after 6 months of them, scientific people asking me, but you, Michel, you are not a scientific guy. Why do you want to work with us? So after 6 months, they understood, so we worked together many years. So I'm not a microbiologist, but I understand what a bacteria is. I understand what an antibody is. And I had many discussions the first year of COVID in Vietnam with the Vietnamese people. I spent most of my time with Vietnamese people about, COVID coming to Vietnam or not. And my Vietnamese friends made the point that COVID would never come to Vietnam, and they were quite successful during 1 year. And my point was, it would come. So you know the rest of the story. So before I ask my question, 2 quick stories. I was in that conference, the same topics, different speakers, 30 years ago. In Portugal or in Germany or in France. The knowledge already exists. So what you in Vietnam are going through now and are going to go through in the next 5 years, 10 years, the story and the experience and the education exist already. And the second story is before COVID, there was another, pig epidemic in Vietnam. Do you remember? Before COVID, the pig epidemic and the millions of pigs that were slaughtered in Vietnam? Who does remember? Thank you. The UNBD authorities in Saigon, after the pandemic, contacted my main partner, asking him, how do they do that in other countries for pigs? Okay. So he asked me. And I asked a man whose wife is Vietnamese, more than 20 years in Vietnam, is from Brittany in France, and his activity during 50 years or 30 years of working experience was pig farming. And more than 15 years of his life talking with Vietnamese people here in Vietnam about pig farming. And I arranged a meeting between this man, my partner, and the UNBD authorities in Saigon. And at the end of the discussion, he was saying, well, you know, it's 15 years I'm talking about education. Not scientific education, you do that very well. Process education, change leadership education on the specific topic of pig farming. And he telling them, you know, when you don't do that, like I've been telling you in the last 15 years, the Indonesian companies and the Japanese companies and the other companies, they will come here and they will do it for you. So these two examples lead me to my question, which is, thank you for listening to me, you've been very patient. Do you have any plan to do something else than scientific education on the topic of process education, change management education? How to go from point A to Z, even over a 5 years period? And maybe you have no answer, but that's okay. Thank you.
So I'm not sure at who this question should be addressed. Maybe to more the Ministry of Agriculture.
Thank you for the question and also the comment for the whole topic today. But I think that for scientific field, we think that when the population of the animal increase and over the burden of the ecology, and then more and more disease will appear. That is the easy way to understand. But the problem is, now you want to have safer foods from the livestock and less using the antibiotic, because problem of the antimicrobial resistance in Vietnam and many countries in the world. And you know that in the EU system, in 2004, they already forbidden to use antibiotics and growth promoter for animals. And 2006, the EU already,
Hopefully you have a strong voice so everyone can hear you. Right? Okay.
Yeah, the EU in 2006 already did not allow import the livestock product from the country to use the antibiotic for animal to become the growth promoter. So it is very good policy. And follow that in 2017, China and Canada also apply the same. And 2020, also New Zealand and several countries more also apply similar. So for Vietnam, we very carefully to give the policy how to control the small producer to overuse with antibiotic, because the problem of the AMR. So by at the end of December of 2025, we do not allow the livestock producer to use the antibiotic as growth promoter. But the problem for Vietnam and also many countries, So what is the alternatives you're looking for? Give for the small people, livestock producer, to keep their animal, especially for the young animal. For example, the pig from 1 to 25 kg, the chicken from 1 day to 21 days, and for the cattle about less under 6 months. So we think that have 3 methodology for that. The first one, we have to put very strict biosecurity for a very farm, even large or very small, mini farm. The second one, we have to looking for to research, testing, and deliver the vaccine for killing the disease. And the third, that we have studied very good system, make the combination, not only Vietnamese scientists, but different scientists from international agency to have the new alternatives to replace the antibiotic to become very good or new medicine, but safer for the animal. For example, we're looking for the extract from the plant, from the sewage, from the microorganisms, something like that. And ONMIC, also one example, for the company also looking for different way to give the new alternatives to replacing the antibiotic in the coming time. So we think that the FAO and OIE and WHO need very strong approach and One Health approach. I think the right way to follow now. And Vietnam also follows that way. Thank you.
Thank you. I think, David, you have one question
Yes.
as well.
Thank you. As I mentioned earlier, we are a large agribusiness with many farms throughout Vietnam, particularly pig farms. And what I've noticed in the years, we've been farming it for 20 years here in Vietnam. And prior to that in Australia, I remember times when in farms, farmers used to know the names of and to be able to identify individual animals in the farm. Remember, there was Daisy the cow and Henry the pig. They knew them all. And then with intensive farming, we have herds that are treated as a group. So and when you have intensive farming like that, you increase the risk of disease and disease transmission, as we know. So my interest is now in digital transformation and application and how it is used to manage and control disease by early identification and ability for separation. So the use of sensors, temperature control, and heat-sensitive application. So you can identify when an animal is under stress and it can be separated immediately. So there are opportunities for early intervention and identification. And I'm wondering, and they are being introduced now in large farming operations. So I wonder if you're aware of the movement in that area, and where do you think that's going? Where do you think the digital application in intensive farms is going to allow us to manage, control, and intervene quickly with animal health?
Thank you. I don't know who... Okay. Dr. Chintoi. Yes.
Thank you. So very interesting question, and also the comment as well, talking about the application of information technology and the digital and the other thing, high tech for the agriculture. But actually in Vietnam, we also want to do that here. But however, do know that almost our producers, they are the small scales, so it's so difficult for them. But however, for the big company, look like some kind of a CP or Jaffa or the other one, maybe they and you also from Jaffa, right? And anyway, in our system, I mean, not only about the policy system, also about the education system. Look like Vietnam National University, we are going to study and we are going to promote that one. Look like we have the faculty of high technology agriculture in Vietnam National University, and we try to use that one now. But now I think that for the maybe the look for the research or promoting. So in the future, I hope that it will be growing fast in Vietnam, in my opinion. Yeah.
Any other comment from the panelists on this, let's say, precision health management at farm level? He's just taking, yeah.
Yeah, I know. Hello. Yeah. I think that one is a big one, and for sure it's the way I think in the future the industry will be to be able to detect the animals very early and have the immediate answer. I think in other sectors like fish farming is already very much implemented in some of the large farms. In swine and poultry, I think it will come, but I don't see too many applications yet here available. From my company perspective, some things we have available, not exactly the same, but we have a program, for example, where you can scan the lungs at the slaughterhouse. So you still have people there going there, but they will use tablet to scan the lungs. And with these scans, the company manager, like you, will receive the view on what is the effect in terms of respiratory disease of all the farm system, and will help to take some decision in terms of treatment or vaccination. That's one example. In terms of vaccination equipment, also we see also in the last years trend towards smart vaccination device that it's some kind of syringe that where you inject the pigs, you will have the data go directly to the system, and the management will be able to see, okay, what vaccine has been injected, what time, at what farm, and it helps a lot with the traceability. Just some examples, not 100% the same that you mentioned, but in this direction. I think more will come in the future for sure. Yeah.
And may I give some comment related on this? We know that is some high technology to apply for the farm, like you mentioned, related on the check body temperature of the animal. Or I know one report that is they have one system to analyze the coughing of the pig at farm. Based on this, they can know that is the pig have some problem. That is one, and it's quite common for sow farm, and they have a specific ear tap, and with the specific system, they can measure the daily intake of sow, and based on this, if they have a good feed intake or not good feed intake, so they can come to check. It could be help, but from my side, I think it's in big farm. The main important is we need to keep the good health for all flock. I mean, it's for all animal inside the building. So for me, it's a priority. Much more important is relate on biosecurity. If we can prevent pathogen from the outside get inside the farm, that means we less disease. And another side is some disease we cannot. I mean, it's more risky. And endemic disease, we can use vaccine, because right now the vaccine is the most tool. And if we can combine the biosecurity and the vaccine, I think we can prevent most of the main disease for the animal. Yeah. Thank you.
Well, I just want to add a little bit though. You see, I think the challenge in large farm and small farms are very different though. If you have 2 pigs, 1 pig die, that's a 50% loss. But if you have 1,000 pigs, 1 pig die, probably you won't even know it until 3 days later. So I think remote sensing or any technologies that help you pick up the disease or sick animals faster and be able to isolate faster, I think that's very helpful. And I'm sure there will be more and more technology available in this area. However, one thing you cannot overcome, the one thing that still needs to be done though is still you need a good diagnostic in the end to make a decision one way or another what to do next though after you separate those sick animals.
Thank you. And here again, training and diagnosis is very important. Time for one more question. Could you please introduce yourself and at who you address your question? Thanks. I have to run again. Good for me.
Thank you. Good morning, everyone. My name is Renzo Moro. I'm an agricultural expert of Embassy of Italy. And during the panel, I was asking to myself, I was asking you, if in your opinion, the farmer, in particular the small farmer, are aware about this One Health approach, this is so holistic approach. So, because if they are conscious, maybe they can part of the solution, part of the problem. So, what is your opinion about the farmer, small farmer, aware about this problem? Thank you.
And at who do you address your question? Do you have a specific panelist? Do you address your question? General question, right? Someone that want to...
Well, it's maybe also important to note that especially in pig farming, smallholder farms are harmed quite a lot, especially with the ASF outbreak, African swine fever outbreak in 2019. You saw that especially for the small-scale backyard pig farm holders, they face a lot of challenges because, for example, they have an outbreak of ASF, all their pigs die, they clean up, and a few months later they try again, but then they have another outbreak. So what you now see actually in the, for example, pig market is that small-scale household farms are reducing very fast. And then the gap is picked up actually by the integrated farms, like the Heus, Marvin, Japfa, and so on, because they can control biosecurity. So I think that also the answer for these challenges actually will come from those large enterprises, because at this moment it's very hard to, of course you can educate farmers and so on, but even then you spend your time on education and all those things. But when they come back to their farm, they still have challenges with biosecurity, right? They have a small backyard, and next door is another farm, and next door another, and then if one of those households get an infection of whatever virus or disease, it quickly can spread to other farms by way of people, mouses, dogs, and so on. So I think for the small livestock farmers in Vietnam, in the future it will reduce quite a lot, and it's quite a pity, but I think there's no answer otherwise than that the large integrators will pick up the gap.
And I want to ask some point related on this for small farm and backyard farm. And in Vietnam right now we know that we still have a small farm, backyard farm, but the trend is a decrease because the big company will take more market size for this. But small farms, they can get the knowledge by mainly in Vietnam, mainly from the vet trading company, the first one. The second one is a feed company. And the third point, they can get, they can learn from someone in their community, and they have their own good experience. That is the way of training. For example, our company will also supply the medicine and vaccine. And quite often we have a pupil can go visit this farm to give knowledge and to give advice. And sometimes we can organize a seminar just only for 10 farm or 20 farm in a small area. And by on this, we can share about the biosecurity, about the disease and method to control and something like this. That is the main approach in Vietnam this moment for small and big farm.
Hi, good day to everyone. My name is Sanjeev Louis. For this panel, I'm an advisor to Grow Asia on sustainable finance. So I don't have two stories, but I have two questions, if you'll tolerate that. The first one hopefully is easy to answer. I know this is a panel obviously on One Health, and we've focused a lot on, disease management, transmission, and the science, and lessening the use and proliferation of vaccines and so forth. But I was wondering if there's any comment from the FAO or from one of the scientists on the panel about the impact or influence of feed. I hadn't heard anything about feed and how much that might influence, the same health issues. And then the second question, really for anyone, is about, we've heard a lot of great news about improvement in science, improvement in technology, proliferation of really great tools. What I've heard is probably that large farms can do this. I've worked a lot in my past life for JAP, for CP, and these big guys. They can afford it. How affordable are some of these things for the small farmers? And how do we address that for them if it's not affordable? Thank you. Sorry, my question is really because Grow Asia, we're focused on sustainable finance for farmers, so we're trying to figure out, where do we need to deliver this? What's the product we need to deliver to make it affordable?
Thank you. I think there are several companies involved in the feed activity in the room, so if they want to share some experience. FAT, I think your company is as well involved in the nutritional solution. So if you want to comment or to reply on the question about the nutritional aspect to reduce antibiotics.
Yes, I can give some point, but to be honest, I am vet, so I am not nutritionist, so I'm not expert about this point. But actually, we know that in Vietnam we have, I think maybe we have more than 200 feed mill. Exactly 269 feed mill. So that means we can understand that it's a different level of the feed quality. And if the feed quality is not good enough, sometimes we have some issue related on the common issue like the diarrhea and slow grow. And the diarrhea is more target for, it's in the concept of the small farmer when they give the feed. And after that they see diarrhea and they claim the feed company, and after that they use antibiotic. Sometimes it can come from the feed quality, and sometimes it's not, maybe related on the farm management and another point. But when they see the diarrhea, normally automatically they will apply antibiotic. So that means increase the antimicrobial residue. So with the feed company, when they do good job, good quality of feed, it can help a lot to reduce the antibiotic residue at the farm. And until now, I can say that is for the big feed mill, the quality of feed really nice, because if we see the IDG or FCR compare in other country, I think it's quite similar. Thank you.
Thank you. I could also add that based on European experience, it was a big learning over the last 15 years to adjust the protein quantity and protein quality to reduce the digestive disease at the farm level as well.
Yes, we have 5 feed mills throughout Vietnam, and I must say the quality of our feed is generally very good. But the feed, when it leaves our feed mill, is good. The problem is often with the farmer and the farmer's use of the feed. So when we're talking about diarrhea and other things that come from feed, it's not always about the quality of the feed. Often it's about the handling of the feed once it's at the farm. And I have seen examples when bags of feed are opened and left open for days. There is mildew and mold that grows in the feed. That feed then goes to the animals. They'll complain to the feed miller about the quality of the feed. So there are other issues apart from just the feed quality, and that come down, as we've said a number of times here, to education of the farmer, particularly the small farmer who is buying the feed in relatively small quantity.
Thank you. One last question, probably, Ms. Min from FAO.
Thank you. My name is Min. I am working for FAO Vietnam as livestock production management and biosecurity advisor. And I would like to share with you my experience when I work with small and medium scale farmer, poultry farmer and pig farmer for 10 years. Yes. Not only breeds or feed can reduce antibiotics. Mainly is, we can say, microclimates in the animal houses can help reduce antibiotics use. And one more is the proper use disinfectants. I don't hear anyone here tell about the use disinfectants of farmers. And I can say that most farmers, our farmers, small and medium farmers now misuse disinfectants, and these disinfectants kill all useful microflora in the farms. And this result to increase pathogens. And we can say these common pathogens as mycoplasma, as salmonella. These are very, we can say very strong pathogens in each pig and poultry farm. And farmers have to pay much money and have to use much antibiotics for these two diseases. If farmer can, if they can use we can say probiotics, good probiotics, and reduce amounts of these common pathogens, they can save, they can reduce use antibiotics. And when we help them in this approach, we reduce antibiotics in poultry farm to 50%. And sometimes in some, not much, in some farmer reduced to 80-90% antibiotics. When they use proper disinfectants and when they use proper cleaning, they reduce common pathogens and they reduce antibiotics. And I think here you should pay more attention on use of disinfectants of small and medium farmers, because they overuse disinfectants and they use disinfectants in improper way. And that's my experience. Thank you.
Thank you. Thank you for sharing. Here again, question about education, I think, and training of farmers. Well, if no more question, I think it's time to conclude about our roundtable, to pick up the time. So one first message I would like to have is that I read also on the master plan for animal health in Vietnam one interesting comment. This was that there is a sufficient level of trust among the different stakeholders of the industry that is necessary to impulse the move and the change to One Health concept, and particularly antibiotic reduction. And I do believe that this kind of event organized by EuroCham helps to improve the trust and build up the trust between the stakeholders. So for me, this is a very important basement of any change in the industry. Thanks to our panelists, we had a lot of recommendations, but it was discussed during the discussion. But to enforce again, some recommendation I would like to remind. So utilizing surveillance data for disease control and antimicrobial resistance practiced through maybe a better government engagement with a food private company. Mr. Fat gave some good example in Europe of government veterinary department involved in the slaughterhouse, for example, for carcass control quality to help on foodborne disease as well. So that's also a good example of traceability implementation. Strengthening training and education from professionals. We had a lot of example and specific concern about the need of education and training at school as well, veterinary, animal science and farmers, and particularly in regards of antibiotics usage, prophylaxis concept, biosecurity. Strengthening legal mechanism and enforcement and control of farm practice, and particularly in terms of antibiotics usage. It has been mentioned several times. This is very, very important. Recommendation to engage discussion between the ministries, but we know this is ongoing, right, with collaboration between Ministry of Agriculture, Ministry of Natural Resources as well. And very importantly, and the question was raised also, increase the advocacy and awareness on One Health concept on the non-systematic use of antibiotics, both in human as well for animals. This is very important, and I think this is where Europe has been also very successful, but because it started a decade ago. And as well, promote a lot of preventive solutions that have been that have demonstrated effect, vaccination efficiency, nutritional solution, as well as auto vaccine. There are today a lot of technology solutions that could support this approach, but based again on the trust between the different stakeholders of the industry to move together on this One Health concept. So I would like to thank a lot our panelists today for their nice contribution and participation. If we could have a clap for them. Thank you very much, and they are all available for any discussion. I mean, to continue during the coffee time or the lunch. I think now it's time for the last panel and roundtable, so I will let the microphone to Paul. And thank you very much for your nice question and contribution. Thank you.